Right. Well, for those of you that are here, welcome. I'm Ellen Hahn. I recognize a lot of you, but I actually see some new names. So I'm the director of UK CARES, Center for Appalachian Research in Environmental Sciences, and we do a monthly seminar. So I'm really glad you're here, and we're excited to have Dr. Liam O'Fallon from the National Institute of Environmental Health Sciences speaking today. But before I turn it over to Erin Haynes to introduce Liam, I just want to give you a couple quick reminders. If you are a member, you should have this in your calendar. And if you're not a member, you still can come. But on December 12th from 2 to 4, we have our State of the Center Science meeting. And that is an exciting time to celebrate and have posters and celebrate our publication of the year. So please put that on your calendar from 2 to 4. It will be virtual again this year, December 12th. And lastly, I just want to remind you that October 31st is coming soon. It's not only Halloween, but it's the closing date for UK for KY, the rapid response program that we pulled together in response to the recent flooding in Eastern Kentucky and any projects related to climate and health. And so that's coming soon, October 31st. So anyway, good to see you. And Erin Haynes, I'm going to turn it over to Erin, our Deputy Director.
Excellent. Thank you, Ellen. So it's my pleasure to introduce to you today our speaker, Liam O'Fallon. Liam has worked for the NIEHS from the inside of our main funder for our program and many of our research to drive community engaged research. Since 1999, he has been passionately pursuing CBPR, community-based participatory research, environmental health literacy, community engaged research. He does this from the inside, but also a strong networker throughout all the fundees. So if you have an interest in community engaged research, your number one contact should be Liam O'Fallon at NIEHS. Just email him directly. I'm sending out his calling card. Hopefully he has his email on here to see who's funded in the area, brainstorm ideas. He will network you. He is also, a leader among leaders in the community engaged research world. He was a co-chair of the last year's IFPS meeting that we held virtually. And he attended numerous national and international meetings promoting the work of community engaged research for environmental health science. So Liam, it is an absolute pleasure and privilege to have you here joining us today at the University of Kentucky. I wish you were in Lexington, but we will take the virtual meeting. Thank you so much.
Well, geez, Erin, thank you very much for that very warm welcome and introduction, and for the invitation to be joining you today. Thanks also to Dr. Hahn as well, as the leader of the UK CARES Center there. It's absolutely fantastic, and I'm looking forward to today's conversation. So let me go ahead and share my screen. As Erin said, I am with the National Institute of Environmental Health Sciences, and hopefully many of you are familiar with our institute. We're one of the 27 institutes at the National Institutes of Health, and we're the only one that's located in North Carolina, which sets us apart in that way. And it's nice to be outside of the rat race of the Washington, D.C. area and enjoy the natural beauty that North Carolina has to offer. So as Erin said, also I have been at NIEHS since 1999. And so today's conversation that I'm going to have with you is a bit about the work that we've been doing here, and especially with regard to community engagement. It is one of the reasons that I really wanted to come to the National Institute of Environmental Health Sciences back then. I saw it as an institute that firmly embraced, understood, and really championed this. At the time, it was a new notion of how to work with communities and really support that partnership between academic research institutions and the local community groups. So as my title on my slide indicates, community engagement, an evolving approach to advance environmental public health. So let's just go ahead and jump right into it, and acknowledge that community engagement in environmental health science research is valuable, all right? Here are some of the reasons that we've often talked about. It builds the trust between the academic researcher and the community partners. It inspires the next generation of folks. I think there at UK Cares, you can point and think about several activities that are going on right now that are working with youth and really informing them, bringing up their understanding of environmental health and inspiring them to learn more about the science and learn more about how the environment affects their health. It's raising environmental health literacy. More about that later. It informs health protective policies. When people know more and understand what's taking place, it can help to use that science to change policies that might have, or to inform policy change to reduce exposures, to make life better for others. It builds capacity for all partners. It's not just about the community, building capacity of community partners to be a part of the environmental health science research process. It's about building the capacity of researchers to be more effective, to be more understanding, to really fully engage with communities, healthcare professionals, policymakers, and others in terms of working together, because it does take many people. And then finally, through community engaged research, it advances environmental health science research. So these are just a few that I've come up with, but I invite you, since we're all in a virtual space, that if I've missed any on this list of mine, to please go ahead and drop them into the chat box. Benefits that you see of community engagement in research. And you can do that now, you can do that, as we go along. However, we have to be thinking about why and how, and what does it take to be able to do, this work. And so it requires time. It requires that we listen, that we come with respect for the local knowledge. That includes tribal ecological knowledge. It includes language and culture. We have to be thinking about equity in the work that we're doing in this space. And we have to come with humility too, understanding that we don't have all the answers when we come to this. And finally, we have to be authentic about our engagement. So these are some of the things that I hope to be able to touch upon over the course of the conversation and this presentation today. But before we really jump into community engagement, I think that what we really need to start with is talking about environmental health disparities, environmental justice, because I really believe that this is truly the foundational element of why we get into community engagement. It was truly one of those issues that I saw of science being responsive to the needs of communities to bring about, to reduce those disproportionate exposures. And so when we think about environmental health disparities and environmental justice, we look at it we're looking at it in a couple of ways. They're sort of intertwined. There's this sort of a continuum where health disparities, as you can read here, they take place over time, including environmental exposures related to natural and man-made disasters on especially vulnerable communities, where those exposures amplify or increase the existing health disparities in the communities. Environmental justice, the fair treatment and meaningful involvement of all people, regardless of race, color, national origin, income, respect to the development, implementation, and enforcement of laws, regulations, and policies. So again, thinking about that involvement of all people. Environmental health disparities. They occur in vulnerable communities, low SES, limited no access to quality healthcare, proximity to multiple sources of pollution. You can see what's going on, the list here. And I know that many of you at the University of Kentucky are doing work in this area. And you can immediately think of the various communities that are disproportionately affected that would fit within this notion of environmental health disparities. And efforts typically over time have been focused on ameliorating the exposures and the negative health outcomes, and not necessarily thinking about the causes, those underlying social determinants of health, the structures that are in place that cause the disparity. And so that's where we think about that connection between environmental health disparities, research, and environmental justice action, where the research of environmental health disparities is looking to examine what those connections are. And then the environmental justice brings the action, the response to our understanding that comes through that research. And so it becomes just moving forward. And so when you think about that and you think about the definition of environmental justice, it really becomes that notion. It sinks home the realization that communities need to be involved, and brings home the value of community engagement in the research process. So grounding it further, thinking about the principles of environmental justice, the 17 principles that came out in 1991. I'm not going to go through all of them. I just want to call out the 3 that are highlighted here. Environmental justice demands the right to participate as equal partners at every level of decision-making. Just let's sort of let that sit in. Right to participate as equal partners. Environmental justice affirms the right of all workers to a safe and healthy work environment. And environmental justice calls for the education of present and future generations, which emphasizes social and environmental issues. So these are, 3 critical elements. And I'm not going to talk about this one that I just highlighted in purple. And instead, I'm going to put a plug in for one of my colleagues, Sharon Beard, to be invited to present about this amazing worker training program that NIEHS has, because if you're not familiar with it, it is definitely a good lunchtime conversation. But to be thinking about just sort of grounding it in those, and I hope to touch upon number 7 and number 16 there. So environmental justice, environmental health disparities as this stimulus for community engagement. 1994, I wasn't at the Institute just yet. It was 5 years prior to my time, but this was a critical moment, sort of watershed moment for NIEHS. A symposium on health research and the needs to ensure environmental justice took place. It was the typical 3-day federally organized kind of conference. Community was invited to sit and listen to the various presentations that would be delivered by the invited speakers. At the time, that did not go over very well. And many of the community advocacy leaders stopped the meeting, and they told the organizers, they said, this isn't going to do. We need to come up with a new format, a new agenda, to be able to really clearly articulate what the issues were. And at the end of the 3-day conference, they came up with a whole list of recommendations from that. But I just wanted to call out the following 3 that you see here on the screen, emphasizing that science is a tool for the people, that research can and should be conducted by community, and that when you are doing environmental health research, that you need to be communicating clearly the purpose of that project to the community with which you are working. These were all in response to things that had been taking place that were critical and important. And really what at the end, you boil it down, the bottom line was that the community residents wanted to be engaged in the research process, not as subjects of the research, but as partners in the research. And so this was, as I said, a critical moment for the NIEHS. And at the time, the director was Ken Olden, and he took this meeting to heart. And he came back and he said to I'm putting words in, but in effect, you can see from this timeline, we need to do something about this to be responsive to what we heard at the meeting. So in 1994, you see the development of several new programs that really were innovative for their time. Environmental justice for partnerships for communication, this community-based prevention intervention program, participatory research program. There was a developmental core center program back in the early days that had a focus on environmental health disparities and building connections with health HBCUs and other colleges and universities. But you can see that there was sort of from 94 moving into the present day, a variety of programs. And so what I want to do now in the next 20 minutes or so is I will talk a little bit more about these, but I also want to just, again, talk a little bit about what we mean by community engagement and seeing it as this spectrum, because this is something that has evolved over time. At the beginning, perhaps it'd be like, are you doing community engagement? Yes or no. It has evolved to more of an understanding of the general spectrum, from the unidirectional outreach to inform, consulting, involving, where you might cooperate a little bit more, to the collaboration. You've seen this term bidirectional communication or multi-directional communication. We use it a lot in the Core Centers program, where now you're getting further up the scale of community engagement. Shared leadership. This is what most people would call or term community-based participatory research, where you have where you're really empowering the communities, participants to be leaders. You're tapping into their power. You're showing the power within them, as Jacoby Wilson from the University of Maryland calls it, empowerment. And then moving on to the community-led, and that is really that next step of where the community is driving the research questions. They're at the forefront. They are inviting the researchers to the table to participate. And as we think about community engagement, we also have to think about how and in what way are we doing community engagement? Is it focused strictly on the capacity building of, the training, the asset mapping, really helping to identify how the communities and universities can come together? Is it about doing research? Is it communicating, translating the science back, disseminating the findings out? Is it moving to that action and sustainability? How are we thinking about communication or community engagement in these kind of 4 different areas? And they are interrelated, but there's limited graphic capacity here on PowerPoint. But the notion that there are these different ways that we have to think about how we are engaging with communities. So what I'd like to do now is just talk about some of the program highlights for the Environmental Justice Partnerships for Communication, which really had a focus on capacity and communication, because it was first of the kind. Researchers and community groups weren't working together very much in environmental health science. The CBPIR, community-based prevention intervention research, and the community-based participatory research program. The ongoing research to action, the environmental health sciences core centers. Hopefully you're all pretty familiar with that. And then the environmental health disparities centers as the 5 programs that I'll just highlight. So starting with the EJ, Partnerships for Communication. This was our 13-year interagency program that started in 1994. And through that period of time, we ended up in partnership with NIEHS and EPA and others, ended up funding about 54 projects. And the goal of that was to begin building the trust, identifying the best strategies for enabling communities, community groups, researchers, and healthcare professionals to begin working together to address environmental justice issues. In 1998, it did start off as strictly in educational, but then in 98, they started to incorporate more of this focus to think about what are the research strategies to begin answering some of the questions that were coming up. And then in 2002, it required an evaluation plan, as well as the encouragement of a social scientist to be a part of the team. In 2009, we did we did an evaluation of the program, and we wrote up a publication in the American Journal of Public Health to look at those 54 programs. And we wanted to see how well they were raising community awareness, building community capacity, and then the outcomes, the short-term outcomes of improving health behaviors. Was there increased funding for doing work, as well as the long-term reduction in exposures, regulatory action, et cetera. And so we articulate some of the changes, the benefits of those partnerships, and the evolution. So if you haven't read that article, it is a nice one to just really sort of summarize the key impacts. But the bottom line is that it was showing the value and the strategies and the impacts of community engagement in research, as well with researchers, as well as with healthcare professionals. So this program helped to inform. Oh, and here's an example of one of the projects, and this is one of the reasons I chose this example is because it shows sort of the continuity across. So Silent Spring Institute received one of the environmental justice projects focused on breast cancer and environmental justice advocacy through a variety of different engagement approaches. Was focused in Cape Cod, Massachusetts, and Richmond, California. Perhaps you've heard the story before, but they collected in-home environmental exposure assessments, focused a lot on endocrine disrupting chemicals. And the community weighed in, and they said they were interested in looking at pollutants from nearby industry as well as from transportation. And so this group, through their research, and then they also reported back the findings to their community partners. And so the findings from this project informed policy change in California regarding flame retardants in furniture, based on the findings. And then also their work in report back really began this to inform future efforts and the evolution and the refinement of the reporting back process. And so Silent Spring Institute has become a recognized leader in reporting back research results. Julie Brody, pictured here, really has become that recognized face for reporting back research results to community partners. So the EJ Partnerships for Environmental Justice did lead to this community-based prevention intervention research and CBP and the community-based participatory research programs. So the first one, CBPIR, was an R21. That was more of a I don't want to say pilot, but it was to help get projects started. And there were 13 projects funded as part of it. And it really was to develop and implement improved prevention intervention strategies that involved the community partners. And then that went on to become the community-based participatory research project, which was an R01-based project. And there were 9 projects funded over the course of the 5 years that was active. And that required the active cooperation and participation of organizations. So I grabbed this particular quotation in the green box out from the CBPR program RFA, saying community input is the most meaningful and best utilized. It's built into the research process from the outset. So again, the acknowledgement that that community needs to be involved as soon as possible in defining what the research question was is going to help out in having the best impacts. And the efforts in this helped to inform this workshop that we did called Successful Models of Community-Based Participatory Research at a meeting in 2000, where we brought together leaders in this area to start thinking about what were the critical elements informing community-based participatory research. And it really was a bit of a seminal piece in helping to move and shape the conversation at NIH. An example from this is Tribal Efforts Against Lead, and they used a social network approach. And this was in Ottawa County, Oklahoma, looking at legacy mining exposures. And they used community-based participatory research approaches to incorporate the Native American social networks. And they focused on clan mothers and clan fathers as lay health advisors. And through this research, they were able to show that they were able to inform policy change. They increased blood lead levels for children, blood lead screening for children. And what was frightening was that there was a practice of spreading mine tailings on the roads in the rural areas. And as a result of this project, they were able to inform a policy change to discontinue that. As part of their evaluation process, what they were able to show is that through this community-based participatory research effort, that the social networks, the tribal linkages with local, state, federal agencies increased over time, that they could see the interrelationships strengthen and grow as they engage with their partners. And so I included just one of the social network maps, the end one, that shows sort of that nice intricate matrix, the tight network of connections. The first one was like three or four lines, and you could just sort of see this map grow as a result of utilizing community-based participatory research approaches. So again, seeing the connections, the relationship building. Now, over time, those evolved to the Research to Action program. And hopefully you are all very well aware of Research to Action, as we are currently supporting two projects there. Doctors Hoover and Unrein and Hahn all have a Research to Action project, and then a previous Research to Action project with Doctors Browning and Schoenberg. And this is building off of lessons learned from the previous projects or previous programs, supporting this community engaged research. This is very much research and research-oriented communication and looking at the action. What we were hearing over time was that community groups no longer wanted to see research for research's sake. They wanted to see research that was leading to some type of a public health action effort. And so we incorporated it into the requirements of this particular program. The question has to be defined by the community, and the research is helping to inform the community's question, and the community needs to be involved along the way, and there has to be a public health action plan. So it's multidisciplinary, collaborative, the potential health risks of environmental exposures that are of concern to the community, and you can see the project elements: engagement, research, public health action, and hopefully some evaluation. We're currently funding 14 projects. You can see them listed here. Here's Jason and Anna looking at the disinfectant byproducts. And we've got Ellen here with Radon on the Radar. And then the other one had been the Mountain Air Project. And so these are all really critically important kinds of projects. And they've dealt with a lot of issues working with a variety of communities that you can kind of get a general sense of the types of topic areas. I'm going to highlight just two efforts. Hopefully I don't need to talk about the three at Kentucky. So here's one that was recent, or that had been a previously funded one, and it was Home Air and Agriculture, this HAPPY study. And it really spans the environmental justice program. And then they had received 2 rounds of Research to Action. And through this, they were looking at Latino children out in rural Washington. They wanted to understand, they started off by understanding what the exposures were, where they were coming from, and then beginning to think about what the appropriate intervention was. So working with promotoras, community health workers, for an asthma education, as well as including a HEPA filter intervention. And as you can see here, they were very successful in reducing the PM 2.5 levels in the children's bedroom, as well as living room. So it was that combination, but it was this community university partnership that was really working to show the benefits of this approach. Another quick example was a community air pollution mapping and monitoring program that took place down in Imperial Valley, California. And this was the researchers working collaboratively with community partners to identify the best places of setting up these community air monitoring networks to really understand what the air pollution levels were and how it was affecting health. Through this project, they were able to inform a California legislative measure to fund programs focused on reducing air pollution in EJ communities, but it also demonstrated the value of this approach of community air monitoring and embracing that and recognizing that that communities could be engaged in this kind of effort. So this has been and then the partnership has evolved now to a different research to action project that is looking at the health effects of respiratory health effects in children from air pollution in the Imperial Valley. And so they've been able to extend and build upon the partnerships that were established there. So now transitioning a little bit, we've got the Environmental Health Sciences Core Centers program. As the program is to bring people together across a university, to be that intellectual leadership, foster innovation, to translate the research, support new ideas, and most importantly, the last bullet there, engage communities in multi-directional communication. And we have seen a tremendous evolution in how the core centers have been addressing this notion of engaging with community members. I will say that in '99, when I started working at the Institute, the idea of community engagement is completely different than how it is today. Back then, it was much more about unidirectional. Let's just create a fact sheet. We will tell you a little bit about what we're doing in our center, and here you go. And now what we are seeing is a much more integrated trust building, relationship building kind of role that the community engagement core plays in reaching out, building a relationship with a community or the identified audience, bringing those issues back to the center, working with center members to identify the assets that can meet those community needs, and then also to be serving in this role of building capacities for researchers, for communities to be working together in broader ways, whether it's through pilot projects or through some other type of research effort that might be taking place as part of the Environmental Health Sciences Core Center. So like I said, when I started, it was about unidirectional communication, and now we've got very engaged, actively involved community advisory boards, stakeholder advisory boards. We have grant programs, mini projects that encourage and bring in community ideas to the center, and you see greater responsiveness of center members to go out, interact with community organizations, community residents, and bring their their expertise to address the questions that they have. One example that I'd like to bring to you is the work that UC Davis is doing. And they've established a story map that highlights and demonstrates the community research priorities that you can see here. And it's a very interactive story map, and I'll make sure to share the links here with Drs. Hahn and Haynes. But in effect, this gives the researchers the opportunity to really see what the questions and concerns are of the community, and helps to make some of those the connections so that the researchers can respond to those particular issues. And it's, like I said, it's very interactive way of bringing those issues to the forefront. Now, lastly, I'd like to just talk about our Centers of Excellence in Environmental Health Disparities Research. Unlike the core centers, these centers are about research. Core centers are about bringing people together. It's providing the institutional facilities, the core facilities, whereas with the Centers of Environmental Health Disparity Centers, this is about doing research. And so from 2015 to 2020, we, in partnership with the EPA and the National Institute of Minority Health and Health Disparities, supported 5 different centers focused on environmental health disparities. And from 2020 to 2025, we are working with the National Institute of Minority Health and Health Disparities and the National Institute of Child Health and Disease to support 3 ongoing, or to support 3 centers. And those are located in Southern California, Baylor College of Medicine in Houston, and at University of New Mexico. The Baylor College of Medicine center is new. The other 2 were part of the original 5 cohort. And you can see what the type of work that they're doing. But each one of a mandate within these is to really facilitate and enable community engagement in the research process. And these can be similar to the core centers in terms of fostering that trusting relationship. In addition, you see greater use of community engaged research approaches to answer the questions related to the environmental contribution to health disparities. The highlight that I would like to bring here is one from the previous round of centers, and this was the Harvard Boston University Center, or the CRESH Center. And the reason that I like this particular example is because it ties into the COVID pandemic. The center was able to, with their community engagement, with the mapping expertise that they were doing to show to map out health disparities, to look at the questions that community partners had, they were able to pivot and also use that information to show the disproportionate impact of the COVID-19 pandemic on certain communities, typically the more under-resourced communities, the ones that were facing a lot of disadvantage already, a lot of the environmental health disparities. And so they brought their skills, and with this mapping approach that they used, they were able to help to inform an environmental justice policy brief released by the Massachusetts Office of the Attorney General on COVID-19 unequal effects on Massachusetts. So seeing how these kinds of centers in partnership with their communities are able to respond in real time to an ongoing public health disaster. Now, Aaron said that I'm all about trying to bring people together, and it's true. I'm an enabler at heart. I like to see people succeed. And one of the things, as we evolved our understanding of community engagement and the different approaches, we also saw that these different programs were siloed, and we needed to come up with a strategy to really bring people together, to enable them to share their knowledge, to share their understanding and learn from one another. And so we established the Partnerships for Environmental Public Health. And perhaps some of you have heard, receive our newsletter and have received emails from me about this. But this is a community of practice. It doesn't, it brings together all the different programs that you saw in that timeline page, the active programs, as well as R01 funded researchers that have sort of this focus on community engagement and research translation into to look at these common themes, these issues that we have. And it comes around those same topics that I talked about before: capacity building, research, communication. And as we look forward, we're adding in this action and sustainability piece. We want to be thinking about the future and how it is that these community engagement efforts can be sustained over time. And through the PEPH program, this network, we've helped to inform different program development, research to action, some of these centers that you're seeing, these efforts that you're seeing here. In addition, it's helped us to identify and advance new areas: environmental health literacy, citizen science, tribal ecological knowledge. And so it's kind of helped to push, because when you bring all those people together, you're able to see the interconnectedness. You're able to accelerate some of these conversations that you would have had maybe with yourself or within your own center, but now you're getting it across to see how somebody in New York City might be talking about the same issues that you're talking about. So I'm going to quick go through this because I see we're starting to run out of time too. As we also, as part of the PEPH conversations, and I think, Aaron, you might have been at the talking with Sima and myself about this. But as federal agencies started to talk about citizen science and the engagement of community partners in research, we started to think about, well, how is the best way of showing this? And we thought about academic motivations. You know, typically starts with a PI expertise, their training, the scientific questions, and it leads to sort of publishing and disseminating the research findings that go back to the scientific question at hand, right? And the motivation for within sort of that academic sphere is tenure, promotion, you know, institutional recognition, right? You flip that over, and from a community motivation, what is a community most motivated about in terms of participating in research? There's an exposure, there's a disease awareness, there is a question and a concern that they have that they want answered. And when you get to the end of that, you know, move along that spectrum, it gets to translating it for a public health action that goes back to inform that question or concern, right? And so, you know, are these two really, is there a huge gulf between the two? And I would say, no, there isn't. You know, that is where community engaged research comes into play to really help to bridge this, to be able to identify and acknowledge that there are two different motivations that we need to be thinking about that can be bridged through community engaged research, somewhere along that spectrum, through civic science or through citizen science efforts, through youth engagement, perhaps participatory action research. And that as you move along this blue arrow, if you're an academic, and you're working with community partners, you get to the collection and analysis of data, perhaps that helps, that raises a question or a concern at a community level that the community feels that they want to run with along their sort of green trajectory here. Conversely, through a community-led program, if you've been invited to participate and be a part of that effort, under the reviewing of results, maybe that piques a scientific question that you're able to move through. And so it becomes sort of this nice balance, a synergy of the different motivations, but motivation is key. I'm going to give a call out to Yosira Van Horn. Dr. Van Horn and colleagues developed this very nice framework here that I think summarizes what I've been trying to say in grounding this conversation in environmental justice. Within this, she and her colleagues worked to develop this new framework that talks about the different principles of environmental justice and how it ties in to basically the scientific research agenda in academia, led by the investigator, moving to sustainability, ending, you know, ends with the funds. This article just came out in early 2022. If you haven't seen it, haven't read it, highly encourage you to do it. It's a very elegant model and a really nicely written piece. The other aspect about it is it's cross-cutting. You see that it's University of Southern California working with Columbia, working with Arizona. So it is also collaborative in terms of bringing together leaders in the field to discuss this. And I reached out to Yosira, and she had said that their goals is to have an even broader conversation within the Core Centers program about how this can be acted upon. So looking forward to learning more about this. So again, coming back to this, it builds trust, capacity, informs policies, it inspires the next generation, it raises environmental health literacy, it advances research. But it requires all these elements. So why is it important now more so than ever? We have climate change and disasters on the front. We acknowledge that climate change is going to disproportionately affecting certain communities, certain populations. We need to be thinking about how those community partnerships, those trusting community partnerships come into play to be able to address this, to be able to communicate in a culturally appropriate way. Even through the executive order and tackling climate crisis at home and abroad, it calls out the importance of climate injustice, the need for addressing those disproportionate exposures. At NIH, there's been the Climate Change and Health Strategic Working Group, and this framework has come out. Health effects research, health equity, the need for training and capacity building, intervention science, dissemination, implementation. I know that Aubrey Miller has spoken with the group. Disaster research response is integrated within all of this. Central to it is that need for community engagement. We need to be thinking about how it is that we are working with, responding to, listening to the needs of our community partners. And you can, if you go to the climate and health page, you can see where there are different funding opportunities. As part of another ongoing NIH effort to respond to the COVID pandemic, there had been the development of the NIH Community Engagement Alliance Against COVID program. This was led by NHLBI and by the National Institute of Minority Health and Health Disparities. I'm not going to get into the details of it, but it demonstrates, but through this, there has become this increased awareness about the value and the importance of community engagement, authentic community engagement. And I'm bringing it up in the context of the climate change and disasters as well, because there was a collaboration, I hope folks saw it, about the Alliance for Community Engagement, Climate and Health that was put out that tried to leverage, that seeks to leverage the infrastructure and the national level work through the SEALs to focus in on climate change and health. Another topic, another reason why community engagement is so important is through environmental health literacy. If you need to learn more about environmental health literacy, look no further than your own Dr. Anna Hoover, who has been really at the forefront in informing what environmental health literacy is, the importance of it. And it's been a pleasure working with Anna, with Dr. Hoover in this context of environmental health literacy. And one of the reasons that we want to be thinking about it is sustain research beyond project terms. However, as my colleague Sima Finn and I put out there, validated measures of environmental health literacy are needed. Since we came out with a commentary in 2014, we've really seen this topic emerge, and it is central to the notion of community engagement, because this is where we increase the awareness of how the environment affects our health, and how, as we move along this spectrum of recognizing what the issues are, to creating and acting upon the knowledge that we've gained, that we are able to see, action take place. And so Dr. Hoover, along with colleagues at UNC, Dr. Gray, colleagues at Arizona, Doctors Lindsay and then also Andriota, have been really working to advance our scientific understanding and the utilization of environmental health literacy in the context of community engagement. And lastly, I really want to come to this notion of reporting back research results and the need for communities. As we work in partnership with community groups, trust is essential. And we talk about gathering more and more data, big data at different levels. But how is it that we're reporting those data back to our community partners? In 2018, the National Academies came out with this report about returning individual results back to participants. Many different recommendations came out of that. At the same time, the Partnerships for Environmental Public Health had a grantee meeting focused on reporting back research results. We got additional recommendations. And most recently in 2022, there was a workshop on gene by environment, legal social implications. And again, reporting back came back as a central component. And how is it that these data are being reported back to our community partners? NIEHS has taken that to heart. We had two council meetings focused in on this. And from that, we came to an agreement that guidelines are needed. More training is needed to build the capacity of researchers, funders, IRBs, reviewers, and other partners to support the implementation of effective, quality, ethical report back, and resources, different types of supports. It's not just about money. Yes, we all acknowledge that funding helps, but what are some of the other knowledge bases, resources that are needed to help advance this? So moving forward, I've outlined that a lot's been has taken place. We've gained a lot of knowledge. Now, what are we going to do? My colleague Lindsay Martin is moving the Institute in an innovative new direction, implementation science. She worked to convene this workshop earlier this year, advancing environmental health equity through implementation science. This is a new way. This is how we're continuing to evolve. And if you haven't invited Lindsay to present, this would be a great topic also. You can download the report from the meeting to see the various conversations, the next steps, recommendations that came from it. But this is sort of that next step, new direction. In addition, funding opportunity right now. So Compass, this is a community, a common fund at at the National Institutes of Health. So it's all the institutes and centers. We are participating. Melissa Smar is our program officer on this. But you can see what Compass is. This is about health equity focus. It is about community-led research to address the structural interventions, multi-sectoral partnerships. And you can see the goals here. Here's probably the more important information when it comes to the funding opportunity announcement itself. So currently right now, you have until November 18th for this first opportunity, community-led health equity structural intervention initiative. I think they're calling it CHESI. The team is offering office hours October 20th, tomorrow, the 26th, and the 8th. And that is intended to help out with the submission of the development and submission of a letter of intent. And we'll make sure, yeah, I'm glad that Kara is dropping all this information into the chat box. So conclusions and takeaways, it's a critical tool in our toolbox here at NIEHS. We're continuing to evolve. How is it that we're defining authentic community engagement? How is it that we're building, capacity of all partners? And then more recent conversations, the examination of institutional systems and structures to ensure equity in these kinds of approaches. It's no longer, are you doing it? Yes or no. It's how is it that you're demonstrating this? Is it truly authentic? Is there equity? Are you addressing power imbalances? So keep in mind that every institute has a strategic planning process, and you can see how it has taken place over time. Dr. Wojcik, our current director, will be starting his pretty soon, but these are always opportunities to weigh in on what's important. But you can see that community engagement has been a part of the strategic plan since 2000 under the leadership of Dr. Ken Olden. I won't get into that. So at this point, I know I've gone over, sorry. But for any time that we've got for questions, comments, feedback. Thanks, Erin.
This was fantastic, Liam. You condensed the history of community engaged research into the NIEHS portfolio beautifully and hit a lot of the new highlights. So thank you. I always learn something new when I hear you talk. So this is fantastic. We do have a question about, and first recognizing that NIEHS has been a forerunner in community engaged research across all institutes. And really, Liam, I have to give the credit to you for making that happen. You've been the voice, the driver. So that's you. So thank you.
Thank you.
We all are grateful. The question is, how does NIEHS interact with other institutes to I'm going to say spread the word about the importance of community engaged research across all institutes.
So how is it that we're doing that? I guess, through interactions with our colleagues at the different institutes and centers, partnering with them. Certainly, we've fostered increasing partnership ties with the National Institute of Minority Health and Health Disparities. We've got the shared interests there. So it tends to be inviting them to meetings, workshops, inviting them to sign on to different funding opportunity announcements. So Research to Action, when we released the recent funding opportunity announcement, National Institute of Minority Health and Health Disparities signed on. They see this as a really valuable tool and approach.
That's great. Thank you. I like seeing the evolution of the funding mechanism and how in the very beginning, the community halted the action and then shifted, and NIEHS didn't, hold their ground. They shifted with the community, and that's, you can see that there's clear evidence of that throughout the portfolio.
So I think the key point also with that is the importance of listening. From a federal perspective, we do try to be the enablers. Where's the science? Where are the needs? How are things,
right.
Where are things going? And so by hearing the voices of the community, that helped us respond. And I think that there will be, future opportunities as we move along and have the discussions on diversity, equity, and inclusion, and what that means in the context of community engagement as well. Kevin.
Yeah, thank you. And I appreciate all the dedication towards the DEI efforts. I mean, that's where a lot of my space is within the University of Kentucky. But my question is a little bit different. And it stems from, we have a Victor grant looking at PFAS levels, right?
Right.
And then that community letting our participants know what their outcome could be or whatever. I guess the question is that ever going to go into the NIH application, right? Is that then feeding back your information to the community? Because we're at a point where we're like, we haven't collected data yet, but we're like, uh-oh. Like,
right.
So we haven't put enough probably thought into that for what valuable information we're gonna get. So I guess, is that in the 10-year plan, 5-year plan, never?
Well, I mean, so I think, Kevin, that's a great conversation. A great question, and I think that's where we're starting to go with it and have those conversations. If you are working in partnership with communities and you are collecting their environmental samples that are in their personal space, or their biological samples, how is it that you are reporting that back? And there is not a policy necessarily in place, right, for that. Some groups do it, some don't. And I think that there is a recognized value in report back, and but there are IRBs and other groups that do have questions and concerns about reporting back those data. Is that kind of?
It does. I mean, like, I think the big concern is liability, like one way or the other, right? Like if you report back and like for PFAS, like what do you tell someone? Monitor, and I know there's lots of workshops and things that are taking place. Aaron's been on a lot of those panels that are trying to decide the best way forward. But yeah, like it's that whole ethical dilemma of like, do I report back when I don't know what to tell you? But well, yes, thank you.
Yeah, no. And so I think that's the next step. And conversations are taking place. Like, what is the right way for NIEHS to go? Office of Science Policy is really considering that. So be on the lookout.
Thank you.
Yep.
Excellent. Thank you so much. I'm grateful to have you.
Thank you all very much for the invitation. Glad to be here. And as Aaron said, just drop me a note if you have any questions.
Please take that quick evaluation. We need your feedback, everyone. Thanks for joining.